actually be at the hospital for an overnight stay. You might be having a baby, you might be there for surgery. Dr. Marjorie Dixon. So this is a packing list that you might want to consider because it's all about the planning, as you say.
It's all about planning, and I find sometimes patients feel like maybe they're going on a trip, so they overpack, especially women. We tend to think about things like, oh, well, I might change this, I might change it. You're going to have surgery,
right.
And so you want to be practical about it, but you also want to have some of the comforts from home, which I think is important.
Yeah.
So when you think about it, when you go in the hospital, we have the ability to provide you with everything. However, it's nice to have some of the comforts from home. One of them that's an essential, having had surgery, was a toothbrush.
Yes.
My own toothbrush and my own toothpaste was something that when you have nothing else that makes you feel fresh in a day, brushing your teeth makes you feel good. So that's why we put that here.
I agree.
Also, if you're going to have surgery, sometimes the surgeon has given to you beforehand a list of medications that you should bring and have with you, so that when you're on the floor, they may not have it available to you. So that's why we also added this, like my pills, a little pill, and you actually Monday, Tuesday, Wednesday, Thursday, Friday, so you have it for the duration of your stay.
Lovely.
That's very important because you won't remember if you bring the bottles or where to put them, so you have them packed all ahead of time.
Nice.
So
you also have some literature. You're going to be bored.
You're going to be bored, yeah.
So bring something to amuse yourself with. You may or may not have a television in your room.
Right, and the thing is, you've had surgery and you've had often a narcotic or some analgesic to put you to sleep. So you may bring this, but don't feel sad if you don't get to read your magazine or you don't get to look at your book because you're sleepy and you're tired and you're doped.
Right.
So it's okay to sleep, but if you're going to be dopey, you also want to bring some PJs, some warm, because in the hospital, you know, they have those fancy things that are open in the back for just in case.
Yes, yeah.
So if it's for easy access, right? So if you're in the hospital and something, how you have an IV and you have things going on. So if you have a pair of pajamas, you want to make sure that they're shorty pajamas, like something that you can access your arms with.
Got it.
But it's nice to have a little bit of comfort from home, and then these little teeny socks, easy peasy, Dollarama, like you can get. And it's just something to keep your feet warm, because in the hospital too,
it can get chilly.
It gets chilly, right? So that's.
So, you know, the deodorants, the body washes, any of that stuff that's going to make you feel good, and hello, a charger.
Yeah, I put this because people were like, do you have a charger for me? You come for rounds in the morning, you're like, so how you feeling? Let me take a look at your incision. Do you have a charger for my phone? Like, people are just practical. So don't forget the charger for your phone. And, you know, and women particularly, after surgery, you're kind of shuffled in and out of places. You don't necessarily get a chance to wash your hair. So I added these little elastics to put your hair up and to kind of like MacGyver your hair too. Just so at least you can make yourself present. People come to visit you, you want to have a little bit of your usual self. I'm not saying bring makeup and do all of that, because you might not get an opportunity. You don't have a lot of room either. So that's why we packed a little duffel bag, not a suitcase or something, because you often will get just a teeny tiny locker or something by you, a cubby under your bedside table. So you want to have something that's really compact, and if you can't fit it in this, you shouldn't bring it.
It's not coming.
Shouldn't come with
that
you.
makes sense. Okay, so let's move down to when you are going in to have a baby. If you're having your baby in hospital, you don't have to roll in a huge family-sized suitcase. You're not going to be staying there that long anymore either. They're sort of in and out these days.
You're in and you're out, and the thing is, at the end, it's kind of chaotic, so it's nice to know what to put in the bag ahead of time. So that if you end up going into labor, you can just grab it and go. So these are some of the things that I thought were pretty critical, in as much as, again, having comfort. And the things that you don't necessarily know that we won't necessarily have for you in a hospital are things that will help you around the postpartum period. So nursing, nipples are sore, right?
It's brutal.
So a little nipple. And stuff. This saved my nipples. Because when the baby's really, really small, the mouths don't open, and you have lactation consultants and you're trying your best, and they're like, you know what, when you get out, get it, bring it with you so that you have it. So that's really practical.
They will take that baby and shove that baby on your boob.
And
like, it's almost like it's so aggressive, but that's the baby needs to learn,
and needs to learn it. Actually, in the hospital, when you're starting the nursing before you go home, that's the time where it's not really a lot of milk. So it's just that beforehand, and the baby needs to practice. So you really need a little help with the practice.
For sure.
And they don't necessarily, it depends on the hospital. Sometimes they will tell you what you need to bring. They'll give you a list of what you need. So they'll ask you to bring some newborn diapers. They may ask you to bring some pads. The pads you need to get. Sometimes people are like, what size pad? The biggest, largest pad that you could find.
Get a diaper.
Is the pad that you want to bring.
Get a diaper. So big.
A diaper might have worked, but the pads, when you see them, even as a gynecologist, I was like, wow, those are the biggest pads I've ever seen. Who's going to need those pads? You need them. You need those pads. So those were great. Also, speaking of vaginas, after you've delivered, after you deliver, it's a little tender down there, right? And so not if you've had a C-section, it's different. You kind of walk slowly because you've had your incision. but it's tender after a baby's kind of come through the canal.
Yeah, it's been through a bit of trauma.
Happiness.
It's allowed to be
was
tender.
a little tepid water in a squirty bottle.
Okay.
So when you go to the bathroom, you don't really want to wipe.
Yeah.
You have a little squirt, a squirt of happiness.
Oh, I didn't know. Okay, that's very good. I did not know.
I wish I had opened and taken note, but
No, because you're almost afraid to use the washroom after. You don't want to feel the pain, right?
You don't want to feel the pain and wiping. I should have opened this ahead of time, but that's okay.
Things have come a long way, though. I mean, I almost want to have kids again.
I know, right?
So I can take advantage of a lot of these amazing gadgets that are out there.
But it's not necessary. I actually didn't have, this is way fancier than what I had. It was just, you know, like when you color your hair sometimes, you have that squirty bottle. Same idea. I'm sure you can use any bottle, tepid water on your perineum.
Yeah.
Speaking of bottoms, for the baby's bottom, a little bit of zinc, because the baby also can get diaper rash, and they're really new and they need this.
Right.
And I added this extra stuff because when people come to visit you and you are just having a baby and you have another family, you have another member of the family, so I have 3 children, they often feel left out. And when people arrive, they want to see the baby, and also mom feels left out, right?
Yeah.
So I always include it, and when I visit people in the hospital, a little something for mom.
Oh, isn't that
so
sweet?
Great for winners. Like it's not fancy, but it makes you feel special.
Everyone tried to convince me that the baby was my gift.
I know, right?
Where's my earrings?
I'm like, I want something for me.
I wanted a ring or something.
I thought it was one of the most thoughtful things that people did that they brought. So they brought a little something, and then a gift for brother or sister.
Oh, that's lovely.
To say that, you know, I know it's all about the baby, but we know that you're a big brother or sister, and we appreciate that you're part of this equation. So just having those little things on hand and the thoughtfulness of doing these things is useful when you're in the hospital having babies.
Very nice little list, you stylish doctor, you.
You know.